Assalamu alaikum guys, welcome back to Chai Clinical. So today we're going to be discussing about the physiology of endocrine system. We're going to be discussing all of these hormones that are actually on this page mainly. So for the ADH hormone, you need to know that it actually increases the water permeability. So there are two sites where it acts. It is going to be the distal convoluted tubule, alongside with that the principal cells of collecting duct. It increases the water permeability because the aquaporin channels are inserted on the distal convoluted tubule and also on the principal cells of collecting duct, which helps with the reabsorption of water. So as they mentioned here as well, one important point that you need to know is the alcohol consumption is going to decrease the ADH production, which means that less water is going to be reabsorbed and more water is going to be excreted in urine. So it is going to present with polyuria and dehydration. So one of the important things is alcohol consumption here that you need to know. Then the second part is the corticotroph releasing hormone, which is going to, as we've already mentioned, that it is released from hypothalamus. It is going to act on pituitary gland. ACTH level is going to increase alongside with that because it mainly acts on the pro-opiomelanocortin, which divides into three hormones: ACTH plus MSH and also beta endorphins. Okay. Decrease in chronic glucocorticoids use. That means people who actually use steroids a lot, they're going to have decrease in the CRH level, which means that ACTH level is also going to decrease. Why? Because glucocorticoids are going to be acting as a negative inhibitor on pituitary gland, alongside with that on hypothalamus, because we already are giving exogenous steroids. Dopamine basically mainly decreases prolactin, right? So and also alongside with that, it also decreases the TSH level. It is called as the prolactin inhibiting factor. Dopamine antagonist, which is basically the antipsychotics, can cause galactorrhea, because what happens is that if you block the effect of dopamine, that is going to increase the level of prolactin. Prolactin increases the milk production, which leads to galactorrhea, and also TSH is going to increase, which is going to lead to the signs and symptoms of hyperthyroidism. Then you have growth hormone releasing hormone, which is going to be increasing growth hormone. If it is going to be before puberty, that is going to lead to acromegaly. If it is going to lead to I think after puberty, it was acromegaly, and then before puberty it was gigantism. Analog is called as the tesamorelin, which is used to treat HIV associated lipodystrophy or lipodystrophy. That's how you pronounce it actually, lipodystrophy, and this is important. Then for FSH, LH, gonadotrophic releasing hormone, suppressed by hyperprolactinemia, because prolactin decreases FSH and LH. In return, estrogen and progesterone levels also decrease, which means, for example, if you're going to have prolactinoma, it is going to affect the normal period cycles. Alongside with that, it is also going to have an impact on the bones. The patient is going to present later on with osteoporosis, because estrogen levels drop, and estrogens are actually protective for bones. Why? Because osteoprotection. We will discuss that later. Then it is melanocyte stimulating hormone. It increases the melanogenesis, which means that there's going to be hyperpigmentation in Cushing disease, as melanocyte stimulating hormone and ACTH share the same precursor, which is pro-opiomelanocortin. Oxytocin basically causes uterine contraction, milk letdown, and also social bonding, mood, depression. Prolactin itself, it is going to decrease gonadotropic hormone releasing hormone. That means FSH and LH are going to decrease. Alongside with that, estrogen and progesterone are going to decrease. Pituitary prolactinoma is one of the most common tumors of pituitary gland. Amenorrhea, why? Because FSH, LH are going to drop, so normal menstrual cycle would not occur. Osteoporosis, why? Because estrogen levels have dropped. Hypogonadism, because again estrogen, progesterone have affected, but galactorrhea, because increase in milk production. Breastfeeding increases prolactin, which is going to decrease gonadotrophic releasing hormones. So this is why we say that breastfeeding acts as a natural way of preventing conceiving. Why? Because it actually delays ovulation. Then somatostatin, it is going to be it basically decreases growth hormone and also TSH. also called as growth hormone inhibiting hormone as well. Then there's going to be thyrotroph releasing hormone, which is going to act on the thyrotroph. This is the pituitary gland. Sorry, where did that pen go? This is the pituitary gland on which it is going to act. Thyrotroph cells, which is going to release TSH. It is going to act on the thyroid gland, which is going to produce T3 and T4. But thyrotrophin releasing cell also act on the cells which release prolactin. So when prolactin increases, it is going to decrease FSH and LH. Thyrotroph increases, it is going to present with primary or secondary hypothyroidism, may increase prolactin secretion and galactorrhea. So whenever there is going to be hypothyroidism, which means T3, T4 levels have dropped, it is going to send a stimulus to the hypothalamus to produce thyrotrophin releasing hormone, which is going to act on pituitary gland. At the same time, TSH would increase and prolactin would increase. So increase in prolactin would present with signs and symptoms of galactorrhea. Then there's going to be growth hormone, and we're going to discuss this in the next video.